Hi, welcome back to the channel. Hope you're doing well. Today I want to talk to you a little bit about the ABHRS, or the American Board of Hair Restoration Surgery. As you're doing your research and looking for options for your hair restoration procedure, or who you're going to see or allow to work with you on your hair loss journey, you may see that some physicians are diplomates or certified by the American Board of Hair Restoration Surgery, and some are not. So what does that mean? And that's what I wanted to talk to you about today. So the ABHRS, the American Board of Hair Restoration Surgery, is the only organization in the United States right now that provides a certification process for someone that wants to do that for their hair restoration abilities and their hair restoration surgery knowledge. So every time you see a doctor who's board certified or a diplomate of a medical board, that means that that physician went through a rigorous process of application to even sit for the exam. Not everybody can sit. You have to meet certain qualifications, and I'll go through those a little bit in a little bit here. But once you meet those qualifications, you have to go through a written test and an oral exam as well. So it's not an easy process, but the physicians who successfully complete those steps are awarded the diplomate status or the board certified status of that organization. A few years ago, a few prominent physicians decided to create the American Board of Hair Restoration Surgery, and because there was a need to sort of prove to the public that we had a rigorous process also to evaluate the competency and the safety of hair restoration surgeons in the US and of course around the world as well. The ABHRS certifies physicians from all across the world. There is also the International Board of Hair Restoration Surgery, the IBHRS. So if I am a physician from outside the US and I sit for the ABHRS exam and I pass the exams, I can choose to have my certificate say either American Board of Hair Restoration Surgery or International Board of Hair Restoration Surgery. So they mean the same thing, and they're provided by the same organization. I've been very fortunate to have been board certified or a diplomate of the ABHRS since 2001 is when I first took my test and passed, and I have been very involved with them in the last 19 years. I have served as examiner for both the oral and the written exam over the years. I've been a chair of the written exam committee, which is the committee that writes the test for the candidates to take. I have been in the executive committee all the way from secretary to president, and I was elected president in the year of 2017. So during that year I served as president of the ABHRS. So it's been a great honor for me. There's a little plaque here that I was awarded by them. You know, this has a special place in my heart because it is a very nice achievement, and I have been very privileged to work with them. They are not only great professionals, but they are led by great people too. Many of them are very good friends of mine, not all of them. And we have right now about just a little over 200 diplomates across the world. So not very many actually, if you think about it. So why don't people do that more often? Well, because if you see here, I'm going to show you a little something here. This is from the ABHRS website. So you may ask yourself, why don't more people take it if it's a process like that and it'll actually test your ability? Well, the reason why is because it's not an easy process. These are actually the certification process, just the qualifications, you know. So you have to have a certain amount of hair restoration surgery cases done within a certain period of time, so we can actually consider you for the test. If you don't have it, if you do hair restoration surgery once in a while, you're not going to build up those numbers. So that's for what we call the experience route of certification. There's also a fellowship route, which is if you, after your medical residency or sometime after that, you go through a year or more of a fellowship training in hair restoration surgery. I've trained many fellows over the years, and so you spend time with someone training for a year and a half just to learn how to do hair transplants. So that just tells you how complex this thing is and how serious we take it. And so after that, you can sit for the ABHRS. Now, the people that don't go through the fellowship, then they have the experience route, but you have to accumulate a certain amount of cases. Then it's not just saying that you did the cases. You have to provide the ABHRS with written notes, operative notes of the cases, of a few of the cases. And then a few of them, you actually have to provide photographic documentation, patient testimonials sometimes. So there's a whole process. And then once all that paperwork is received, the ABHRS has a committee for certification that will review all that information. We'll make sure the doctor is, performing ethical procedures, that he's not doing any false claims. All that stuff is done in the background. Finally, once you pass all of that, then you can sit for the written exam and the oral exam. The written exam is 200 questions. You have a couple hours to do it, and it tests all the breadth of knowledge, even from techniques that are not used anymore, but we have to know, right? Because we see patients with those. So, and then the oral exam, every candidate sits with three groups of examiners, usually 2 or 3 examiners per applicant, and they sit through 3 rooms, and they go through a case where they have to, the doctor will portray, the candidate will portray a doctor coming in for a consultation, the examiners will portray a patient coming in for the consultation. So the doctor has to take him through a safe approach, a complete approach, and a safe and ethical treatment plan for that patient. So it is a very well designed exam. It's actually supervised and done under the same rules as most of the other boards are. So it is a very well done exam. So that's why most people don't take it, because it's a lot of work to get it done. But once you do, then you can say that you are board certified. Now, we have to recertify every 10 years. So it's not like you take it one time and you pass and you're done, because the technology, the techniques change, of course, year after year. So every 10 years we have to sit for our recertification. Next year, 2021, I will be doing my second recertification. So 20 years of being board certified. So, I'm dating myself a little bit here, but that's the process. So when you see someone saying in their website or in their accolades that they are a diplomate or certified by the American Board of Hair Restoration Surgery, you can rest assured that that person has a great degree of experience in hair restoration procedures. It has gone through a peer review, and it has passed some rigorous tests to get that. So that should give you some assurance of what that doctor is. Okay, if you have any more information, the ABHRS website is www.abhrs.org, and you can find information there. You can also find diplomate physicians all across the world in their website. So I hope this was helpful, and if I can answer any questions, just write them down below. Sign up for the channel, make sure you like the video so we can produce more content for you, and I'll see you next time. Take care.